Me too, where it's like I'm trying to explain that I think I'm dying, but then it's like, okay, man, you just need to calm down. Like, you're okay. It's fine. You just need to like figure that out. And we definitely did do all the stuff you talked about. Where, like, I did a diabetes test through you, which did come back negative,
Yeah.
but we definitely did lots of testing and all that stuff. And that was, yeah, it's like I think the hardest part was for me to actually explain what the hell was going on, and have someone on the other end be able to tell. And like, I think another thing I wonder is there a place where, like, is there an area like where do you tap out with help with mental health? Like, where, like, because there's obviously certain things you can do. Like, and true, I did actually learn that the first time I thought I had anxiety was from coming in to see you. So like, if I didn't do that, I wouldn't have known what it was. So that was something, but I still didn't really, okay, like I had anxiety, but I didn't understand what that meant. Um, so trying to like figure that out, and then wondering like where, like, I don't know, do you think there's an area you tap out where you would pass it off to somebody else?
Um, just by the sheer volume of patients that I have, I can't spend
Yeah.
2 hours with you to talk about
Yeah,
anxiety.
I
Right?
know.
Like
Yeah.
I can't do that.
Hmm.
So, yeah, so I'm tapping out at that point,
Yeah.
you know,
Like, if it becomes a talking session or something, you
yeah.
would send
So
it to someone else.
in general with mental health, there's three areas that are really important.
Okay.
So, and no area is more important than the other.
Hmm.
The first is lifestyle. So, and I think, you discovered that pretty much, on
Hmm.
your own.
Hmm.
I don't know if we had conversations about it.
Yeah, we
I guess I
did.
said exercise, but
Yeah, you said exercise. I mean, we definitely talked about like, okay, like you're definitely like eating pretty. It's it's just hard to say too. I mean, I guess the word healthy is like everyone's version of healthy is different.
it's true.
So that's a tough
Uh,
way to go with it. But yeah,
A bottle of vodka a day is
yeah.
pretty healthy. Yeah. So, I mean, I try to talk to people about lifestyle,
Hmm.
good nutrition, staying away from alcohol and drugs,
Hmm.
particularly if you're suffering, mood wise,
Hmm.
good sleep habits, do things that you enjoy doing.
Hmm.
In that whole lifestyle thing, probably all relaxation techniques, mind body work.
Hmm.
Some people find human touch, really,
Yeah.
really useful. So that's sort of the one area. And then the second area is counseling. I almost always suggest to people, it's a reasonable idea to try to find a therapist.
Hmm.
It's a real problem because it costs money.
Yeah.
And there's not a lot of good therapists around
Hmm.
who are going to see you for reduced rates. And
Hmm.
not everybody has, an extended health plan that will pay for it.
Hmm.
And then the third area, and like I think almost everybody has issues in their life that contribute to their mood disorder.
Oh yeah.
And I mean, mood disorders are very much genetic, but also very much environmental and often a mixture of both.
Hmm.
So sometimes you'll see people who, by everybody's estimate, they have the perfect life, perfect family, everything's going well in their lives, but they suffer from anxiety and depression. But if you look at their family members, their siblings, their parents, grandparents, all suffered from a mood disorder.
Hmm.
And on the other end is, you know, people who don't really have that history, but someone like their child dies and they become depressed or anxious.
Hmm.
But I think most people are somewhere in that spectrum. So, I mean, I think they probably have the genetic predisposition, but then they also, something in their life is contributing to how they're doing.
Hmm.
So that's what, counseling I think is really, really useful.
Hmm.
And then the third area is medication.
Hmm.
And medication shouldn't just be thrown at you; it should be combined with those other
Hmm.
other things. I remember a study where they took people with anxiety and they exercised one group, another group they gave medication to, and then the third group they did both.
Hmm.
And the group that exercised did just as well as the group that took medication.
Hmm.
And the group that took both or did both actually did a little bit better.
Hmm.
So, and the medication choices range from carrying around something like Ativan, which is essentially a tranquilizer that
Yeah.
that surprisingly though, for a lot of people with anxiety and panic attacks, they carry around the Ativan and they don't need to use it
That is something that we talked about.
because it gives you control back. So when you start freaking out and you're just getting like, I'm going to die, or, you think, oh, I can take one of these pills and it'll calm me down. And then by thinking about the fact that you can take one of these pills, you don't have to take it.
Hmm.
So, I have a lot of people who suffer from anxiety who carry around, 5 Ativan pills. And a year or two later, they come see me for another 5 because the 5 have disintegrated in the bottle. But
Yeah.
but it's like a safety measure that they have.
Mhm.
And then then there's medication you take every day to try to improve your anxiety or your depression.
Mhm.
And one of the biggest struggles in primary care or being a family doctor is the lack of mental health resources.
Mhm.
So to try to access a psychiatrist. So you've done all those things and
Mhm.
somebody's still struggling, and you're doing your very best. It's really difficult to access more resources because
Mhm.
they're so limited. And the truth is there's some significant population of really mentally ill people, schizophrenia, bipolar disorder with, some psychotic symptoms, and the psychiatrists are busy often, and the mental health centers are busy often, dealing with those individuals.
Mhm.
So it's a challenge, definitely is. So
Yeah.
where would I tap out? I'd probably like to tap out earlier
Yeah.
a lot of the time. Not in your situation,
Mhm.
but sadly, sometimes I'm the only game in town
Mhm.
for my patients. So
Mhm.
I do what I can.
Yeah.
One thing in our office now is one of our staff she took the psych nurse course, so she's
Okay.
a psych LPN.
Yeah. Yeah.
She's a really good resource because she'll spend time with people and